very warm welcome to all of my panelists. And I really like to introduce everyone. So, Pankaj Mittal, Dr. Pankaj Mittal, he is Managing Director of the Manipal Institute, Dwarka, and he is having a 15 year of experience in establishing the healthcare startups and everything. So, please round of applause again for the Pankaj Mittal. Manipal. Yeah, Manipal, Gurgaon. Dwarka. Gurgaon, okay, sorry. Dr. D.K. Gupta, he is one of the, he's director of the Felix Hospital who is doing very good in the Noida region and having a capacity of 1,000 beds, trying to expand 1,000 beds in the future and with all the innovative ideas and innovative solutions in, in this hospital. So please round of applause for Dr. D.K. Gupta. Dr. Charu, yeah, Dr. Charu Gupta, Dr. Charu is actually running Ameri Healthcare Home in Faridabad, right? And he's entrepreneur by heart. So please round of applause for Dr. Charu. And okay, Arun Shukla. Hi, hello, sir. Arun Shukla, sir, is a director and managing partner of Vishwakarma Engineering, and he has a long association with this company. So, welcome, sir. Yeah, so please round of applause. And I think Neeraj Lalit Jain. So, Sir Lalit Jain. So please welcome and round of applause, sir, Lalit Jain. So today's topic is very interesting actually and is very close to my heart also because it's about the strategic growth with the innovation and how what are the challenges and the opportunities actually we have in this area. So I really want to know the challenges and the opportunities by our panelists. So this is our first question which I would like to answer by Dr. Gupta, Dr. D.K. Gupta. So, uh, what are advancement in technology impacting health system growth strategies, and how you think that these technologies are actually taking a big leap to the growth?
Can you repeat the question? I think audience के लिए थोड़ा बेहतर होगा.
Yeah, sure. So, question is that how are the advancement in technology impacting health system growth strategies?
Okay, I think everybody will be agree that technology is impacting every industry, not even healthcare. It is impacting right now each and every sector, every industry, every business setup. Without technology enablement, you cannot survive, you cannot sustain, you cannot scale. We talk about the healthcare, definitely. We talk about the hospital industry. Technology is now required for patient experience, for predicting, preventing, diagnosing, treatment. Any part we require support of technology in form of AI, AR, VR, digitalization. If we start from patient experience, then starting from queue management, billing part, teleconsultation, we have done more than 1.2 crore teleconsultation last 2 or 3 years, doing 90,000 per day. And if we talk about this all system, can be integrated in HIS and ERP. ERP will be the backend part where we manage the patient's billing part, account part, HRMS, that is HR part, training and development, and if we got a front end, that will be the HIS. HIS will be billing, OPD billing, consultation, IPD, and all the modules like blood bank, pathology, pharmacy, they will be all integrated. And because of these all integration and good HIS part, because the last discussion was with the related to the digitalization of healthcare only, and especially for the hospital. Then if we have this seamless system, we have intra-operability in the hospital, then definitely the particularly hospital efficiency in form of operations, revenue generation, patient engagement, patient experience can be really enhanced. If we talk about revenue generation, definitely because of patient experience and lead nurturing or lead engagement, conversion rate, every and each thing can be monitored. Even integration with the CRM can help in the lead nurturing part, patient education, awareness, so that your brand value, patient experience will be remain lasting forever in patient's mind. Now, how we can impact it if we talk about healthcare? Technology is the backbone of now healthcare or any hospital industry. If we talk, I have already spoken about the HIS and ERP part. There is a PACS. PACS, you can manage everything, radiological labs reports with the help of PACS, that reporting, even reporting, sharing with the doctors, sharing with the tele-reporting teams, it can be done the PACS. EMR part is there where all the medical records can be stored and shared. Big data analytics, that is the one biggest branch right now coming up. And big data analytics will disrupt this whole industry. Not if we talk about this healthcare, I think all of the other industry are also will be affected in positive way from this big data analytics. Data storing, data sourcing, data management, data segregation, data lake banana, even that pipelines of data, education awareness through data pipelines to the customers will be through only data analytics with this big data analytics. We talk about AR, VR, machine learning. AR is augmented reality, virtual reality, machine learning. They will help in patient diagnosing and the treatment and improving their experience. If we talk about AI, we are all right now, we are now daily reading about the newspaper in the other platform about the chat GPT, other AI platforms. It is going to impact in very fruitful way. There is no loss to healthcare providers, not to the service receiver, that is patient. It will help in not predicting, taking action proactively and preventing the disease. Curative part will be now second priority. Prediction, prevention and taking proactive actions so that we can reduce the burden on our healthcare system. So AI will be helping in the diagnosing, treatment, be it the retinopathy, diabetic retinopathy, skin cancer, skin diseases, gastro problems, cancer problems, cardiac problems. Each and everything now can be diagnosed or interpreted several hours, several days before it will be happening. So how doctors will be enabled technologically, means knowledge wise, skill set wise. So we will be definitely using this all way. And there are other lot of things, maybe robotic surgeries we are using right now with minimal precision, maximum precision and minimal complication rates. So I think there is a lot of scope for the enablement in the healthcare with the help of technology. Or not, we should not talk on the technology. We should now talk on each and every aspect, each and every vertical of technology. Now, each and every vertical like AI, AR, VR, machine learning, or data analytics, they are big verticals. They will impact separately in different ways to the healthcare system.
So, don't you think hospitals are still not very much into changes for these kind of AI and ML thing? There is a lot of means it's a blockage in the hospital system somewhere. Don't you feel this?
There is always resistance if you implement any new system or process. This is the billing power, resilience of the top management and the implementation team, how they go through it. Otherwise, I think if you let them know, train them, educate them, aware them, give them feedback, review them, support them with that, and tell that how it will be useful for them also. How they can track data, they can monitor data, they can control each and everything with a single dashboard on a single mobile app or single mobile screen. I think if you empower with all these knowledge set and skill set to them, and the acceptability will be very high, and the billing should be from the top management, and it will percolate to the second line or third line team members. And there is one more difficult or challenge that is coming right now in India, that is interoperability between the government and private health sector, even in private health sector between different hospitals, because there is no single set of HIS or EMR that is existing, and there is no API connections or there is no exchange of data between the government private sector. So that is the biggest problem right now.
Very true, sir. Very true. So I want Lalitji, what is your opinion on this?
The proposition which we have before us. Now, there are two sides to this coin. One is that nothing can match a doctor's touch and a doctor's feel and a doctor's interaction with the patient. The artificial intelligence and robotic surgery, whatever we may say, but they have their own limitations. My experience working in the government is that rather we are looking for newer technologies which can assist the doctors in better diagnosis. just when I entered this conference, I saw that now we have a moving X-ray. We have a technology which can make a video of the entire film and tell us how the organs are moving. Now again, it's a technological disruption for an orthopedician. So it is something which makes it very clear to him how the bones are functioning, how the joints are going on, and just a small example of what the technology can do. And secondly, since science and technology is advancing with new research and development opportunities and also tools for better research and development, we are now getting newer and newer diseases as we have come to understand human body better. As we get new and new diseases, we dig deeper into the tissues and organs. We again need the instruments, the technology, the science, the way of doing things so that better surgeries can be performed and we know how to fix that problem. So technology is something which has to be there. At the same time, when we are dealing with human beings, technology has to keep in mind the human issue, the human touch, the human values, and the humanity itself whenever it moves forward.
Right. So it's another part of this question. What technology should invest right now for systemic growth in the health system?
Well, in my view, we need better technology in diagnostics.
Diagnosis
is an area where a lot of scope is there, and we are still not able to reach the last hospital in the remotest corner of the country. Diagnosis becomes a big problem. For example, in the state from which I come, we have now worked really hard and we have made rapid strides in the health sector and technological center. But in the whole state, we have just one PET scan. Now, the rate of cancer in Himachal Pradesh is increasing day by day, whatever may be the reason, anthropogenic reasons or environmental concerns or use of pesticides, whatever. But at the same time, for a big state, because it's a hilly area, so for a person to spend 20 hours or 18 hours traveling for a PET scan, again, can we have a technology where we have smaller machines of PET scan which can be placed at the district hospitals?
So in
now,
this,
a few questions.
In this, I think public or government should take the initiative because there is a lot of gap in.
And at the same time, I was listening to the panelists in the morning when all the important officers from the Ministry of Health were there. Now, issue is for a public-private partnership, which is a buzzword these days.
Right.
Everybody's talking about public-private partnerships and whether private entrepreneurs install the machines. Where we miss out is that for a state like Himachal Pradesh, which has a population equal to the district of New Delhi, we are just 65 lakh people. And we don't expect a person to invest crores of rupees and he gets a return.
Right.
So we need to fulfill or fill this viability gap for special category states like Himachal. Whenever we make policies sitting in New Delhi, we need to keep in mind that we also need to talk about Leh Ladakh, Himachal Pradesh, Andaman Nicobar, where people are less. Whosoever wants to set up a machine, he has to be supported in the policy itself by cross subsidies or direct subsidies. And
so is government investing anything in these rural areas or outreach areas?
Of course, government is doing a lot, but again, there's a limitation.
So
because budgets are a limitation, then demand of people is limitation, the vastness of the territory is a limitation, political questions are a limitation, the political values are a limitation, the allocation of resources to what, whom, when and how much. That is always a question before politics.
Exactly.
But development and health cannot wait for those questions.
Right.
So whenever we make a policy in the country sitting in New Delhi, let's keep in mind that there's another part of the country which is very remote and there are a few people who are living there. And in case you want to have a PET scan there, so your viability will come in case you have a special provision for such an area.
So are these implementing on the CSC centers, or how actually they are giving to those services to the rural areas?
Now, throughout the country, after the National Health Mission, we have a primary health center in every nook and corner of the country.
To the PSC centers, through the PSC centers?
No. There are two aspects to your question. One, you are asking me that how are these services being delivered? So again, one is through government and one is through the private sector. So private sector would not like to go to a remote area. It will always stick to heavy cities like New Delhi or Chandigarh or Mumbai, where they find the numbers. For remote areas and for where really the people live, the only alternative is the government sector. In government sector, we have PHCs everywhere. We have big PHCs, better rooms and whatever, but we don't have the doctors. We simply don't have the doctors. We don't have the equipment. In case we have the equipment, we don't have the people who can repair it. So in case you have a X-ray machine in Lahore Spiti and it breaks down, so it will take maybe 6 months for somebody to be there. For 6 months there is snow and somebody may not be able to reach.
Right.
Now coming to the next question, that is telemedicine or whatever such kind of facilities. You're talking about the community health centers. Yes, they are there. We also have the facility for telemedicine, but as I said at the onset, nobody can match the doctor's touch, the doctor's feel, the doctor's interaction with the patient. Half of the job is done once the doctor talks to the patient, tells him what his disease is all about. Telemedicine may be a substitute, a fair substitute, but at the same time, it cannot match the real one-to-one.
It's a primitive care, right? So I would like to, sir, your opinion on this.
Hello, good afternoon. I am representing the industry. We manufacture equipments for the pharma and health segment, and I am representing the small scale industry. We started our manufacturing unit in Nalagarh, Himachal Pradesh, in a very remote area. So lot of due to the location of this industry, it's having a lot of resource constraint, the highly skilled labor availability, but even though with the limited resource, if a small scale industry can improve their products with the incremental new ideas, and with that they can develop a product which can match the world-class requirements, and they can substitute they can come up with the import substitute of equipments. Like Himachal Pradesh is the hub of pharma industry, Asia's biggest hub, and we have not only initially we started this industry to serve the Himachal Pradesh industry, but now we are exporting to more than 8 countries with the support of state government as well as the central various initiatives of central government. I am also representing the Engineering Export Promotion Council. These such platforms, they give a lot of opportunities to display our product and services to even the overseas business. And with that help, even the small scale industry also can serve and support the health industry very well. This is what my submission.
Right. So moving to our second question, and which is I want to take Dr. Charu Gupta, Charu Arora, sorry. So what are the biggest challenge health system face in pursuing strategic growth initiatives? Because this is actually one of the questions which I really like to know from the entrepreneur.
Thank you so much, Saurabh, for this question. So I'm basically a doctor by profession and an entrepreneur by heart. I'm very, very happy to be present on this dais to answer this question. I think the question has a lot of relevance because when it comes to the major barriers, we can actually divide those barriers into certain aspects and divide them on the basis of what we really feel. So number one, I would start with awareness, awareness about anything. We are not even as doctors or as medical professionals, we are not even taught about digitalization, machine learning, AI, VR, big data, not even basics of, healthcare, writing e-prescriptions during our curriculum. And that is one very sad affair because almost 1 lakh doctors, they graduate every year and none of the government medical colleges or private medical colleges are actually teaching how to write an e-prescription. And that's where the entire lack comes into play. So you can't teach an old dog a new trick, right? So it's better to teach them at the right time. And when they are early in their 20s or in their 19s, why can't you just teach them on how to adapt digitalization, because the reluctance to change, as Dr. DK said, will be kind of halfway vanished when it comes from the teachers or the professors' mouth at the early stage of the learning. The second is accessibility. We all think that digitalization or using technology and adapting it into our healthcare system, whether that is a small nursing home or as big as a swanky hospital, becomes very difficult. It comes with the accessibility is an issue, but I don't see that. When you are aware about the technologies which are coming in, you can adapt to them. You have good access to them. You meet new people, and the accessibility increases. It can even help you to reach tier 3 cities and the rural areas of the country. So accessibility and reaching the right desk is very, very important, and that becomes a barrier when it comes from a healthcare standpoint. The third point is learning. We are not very well learned. We are not very well learned about these technologies. You come to such conferences and meetings and you meet people, and that's when you get to know, oh, this really exists. Where was I? Why was I practicing such a primitive way of practicing medicine? Telemedicine was definitely a huge boon. It has been practiced in Germany since 1980s, but it came as a boon to the Indian subcontinent mainly during COVID pandemic. I agree with Pankaj sir when he says that it cannot be an alternative to the human compassionate way of practicing medicine, but I would disagree with him by giving that an option, by saying that, during COVID we were able to even reach out lakhs of people. 32 lakh people were given telemedicine and given the supportive treatment for the necessary and essential medicines which were required during that kind of a disruptive phase, which nobody expected or nobody kind of anticipated. So just if we are learned about it, and we understand that these things really exist, it shouldn't become a barrier, which it really does, telling them of the right thing. The fourth point is cost. Actually, at the end of the entire discussion, even I've been present here for the last 3 years, and we all sit here for 2 days and talk a lot about giving ideas, but the impact actually comes from the CEOs and the CFOs desk, because they are actually discussing about the cost effectiveness and the affordability. Till the time the system doesn't break, we really don't go and ask for a solution. And we have an inherent mentality of just chalta hai, the things are getting done, so why bring in a change and why include more cost? But understand that to bring in effectiveness, to bring in productivity, to bring in efficiency, and a more continuum of care. I agree with what the last industry expert said from Daedalus, that it's all about continuum of care. You just don't start with you don't start with a software to start with the entire treatment, but actually continue it till the last moment. And that's what matters when it includes diagnostics, prognostics, critical care, and everything, radiology. That's what really matters. It should be a seamless flow. And cost can be actually looked at when you compare it with the entire flow. And most importantly, I would say the reluctance. The reluctance from the grassroots level, from the CRM team, from the front desk officers, from the doctors, from the management people. You keep them awareing them, and that's how you're going to break the barriers to bring in any kind of a software or any kind of a technology to disrupt the healthcare system.
So how to overcome these challenges? Because we know all these things, that psychology is the major pain point for everyone, and finances are always still one of the major issues. So how we overcome these challenges? What is your idea?
My only idea, and we have adapted a lot of, we started off as a very small, my personal experience has been that we started off as a very small vertical of home healthcare within a large tertiary care hospital, but within 2 years we did well. And we have kind of adapted a lot of technologies the first time in India and North India by making people aware. When you started Zomato, it wasn't easy. When you started Swiggy, it wasn't easy. When you started Digi Yatra app, now I am 32, and for the first time, just 2 months back, I use a Digi Yatra app, and it turned my entire flying experience so hassle-free. So if somebody is not able to tell you that this exists, and this will give you peace of mind, this will give you comfort, this will give you luxury, this will give you a better experience, then you're bound to use it. So Digi, similarly, if you're awareing your graduates, if you are awareing your students, if you are awareing your nurses, if you are awareing your people at the right time about the benefits, and then telling them that this is going to be a seamless experience and you'll enjoy it, and the patients will also enjoy it, I think that's going to make the game changer. Also, during COVID, we thought that our seniors and our elderly population, because I handle 90% of my patients are elderly population, we had a lot of reluctance that how will we tell them to take care of themselves and their families during COVID? Their kids are out of state, out of the country, and they're living alone. But they were so happy, and they were so so sensitized about the use of small apps like Arogya Setu, for that matter.
True.
Where you really underestimate the power of, we really underestimate our own power. We have an inherent reluctance to change, but change is good. You keep yourself sensitized, you tell them, you aware them, and trust me, it's going to be a game changer.
Right. So, moving to our third question, what kind of partnership or collaboration can health system achieve growth and scale? So, I would like to take this question from Dr. D.K. Gupta again.
I think, question, can you repeat again?
Yeah. So, what kind of partnership or collaborations can help health system achieve growth and scale?
That's a great question, I think. And the collaboration and partnership should be between the different players who are currently existing in the healthcare industry. It will be hospital industry, pharma industry, or between the government and private sector. For the interoperability, definitely between the different private sector players. If we have that collaboration between pharma industry and the healthcare industry, lab industry, and hospital industry, the data movement can be seamless. And with the help of the data movement, everything can be happen. You can have all the reports on your dashboard. You can analyze that data. You can take predictive decisions, implement them, execute them, and get results. That is one thing. Second thing, I think the statutory for stakeholders who are providers for statutory compliances, who are providers for statutory licenses like NABS body, NABL, QCI, JCI, these should be play a very active role for the implementation of technology in different healthcare or hospital industry, because their involvement, their accreditation means a lot. Everything is now revolving around them. Third partner is insurance industry, be it government insurance industry or private. Private means there will be private, and there are TPAs also. GIPSA is there, and there are separate health insurance agencies. I think they all should be coming on one platform so that the processing of the patient discharge process, admission process, even other engagement process, post-discharge consultation should be like hassle-free, should be very, should provide a very good experience to the patients. So between even the government bodies, like there are ECHS, ESIs, PSUs are there. Most of them, they have now come on the one platform, that is billing processing body, BPA. But now still there are several agencies, they are processing their bills offline. They are sending their patients without referral system, without online referral system, with only a document, with a simple document. So I think there is a connection needs to be built up between all these players so that the ecosystem should focus on patients only. It should be patient-centering approach from these all different bodies, so that we can provide a super wow experience to our patients.
Right. Mr. Lalit Jain, so your opinion on this thing. So what are the collaborations and partnerships for taking this as a growth? What are the innovations you actually...
Dr. Gupta rightly pointed out that there are whole networks which are there, which are working in the healthcare sector, and whole conundrum is there rather. So you have the ESI hospital, you have the private hospitals, you have the hospital of railways, you have government hospitals, multi-speciality, postgraduate institutes, and AIIMS. The problem is that all of these are not interlinked with each other. Once we have, as Mr. Roda pointed out, that we have digital prescriptions or a system where the record of the patients is kept online. So then a network is created. And perhaps in our policies, we can have a system where everything is networked, so that in case if a patient starts from a primary health center and is referred to, let's say, a postgraduate institute of medical education and research, so a person need not come with the bulky documents or whatever, and the doctor, before he comes, knows that what it is all about. And secondly, the knowledge network, whereby whatever technological disruptions are there or innovations are there, they are known to everybody, so that we don't do a particular job repetitively in an area. So let's say that certain things can be done better by telemedicine. So why to have a specialist in every nook and corner of the country? Let's have a specialist sitting somewhere at a reasonable distance, and if he can help by way of teleconferencing, then it's very well. Let's say psychologist, as a clinical psychologist. So the initial interaction, rather than being in a clinic, can be through some other media, and we can move forward. So, it's true that we need networks which can work.
So in this, what models actually you seen that working well in this partnership and collaboration? So what are the models you actually seen that working well in this way?
In the previous session, we heard Mr. Vikram Pagadia and the other officials of the health ministry. I think that's a great idea, that the entire database of the patient is kept at a central depository or a central server, and it is accessed by all concerned whenever a patient gets to the hospital for treatment. And second problem, of course, is that is the health insurance. Health insurance is an area in this country where we really need reforms, we really need rules. From personal experience, in case a hospital sends an estimate to the health insurance company, they reply to you within 1 minute that it's rejected. It's a standard reply with 4 reasons.
True.
100% it is done. And till time we have not been able to fix this problem. Then what is the use of health insurance?
Even I saw that lot of Arogya patients and a lot of these patients when came to the hospital, the hospitals are not very much welcome to those patients.
No, true. Hospitals are not keen to treat patients.
Exactly.
Precisely this is the reason, because we are not being able to put proper rules and proper estimates and what is to be done. So rather, they have employed people who are not medicos, and they just read whatever is sent and they reject it 99.9% of the case.
And they said that this is a claim ratio,
yes,
successful claim ratio.
True. So in case we are not able to fix this minimum, the basic problem, then talking about big things would be a utopia.
Right. And what is your opinion on the UHI if it comes?
That is a great idea, and it should come, and it's an idea whose time has come, especially when digitalization in this country is now at every nook and corner of the country. So much so that the remotest Pangi Tehsil of Himachal Pradesh, it is now connected with 5G. So it is the time when we should implement this idea.
Right. So moving to our next question, and I would want to take this question to Dr. Pankaj. How should health system measure the success and ROI of their strategic growth initiatives?
Thank you, Saurabh, for asking this question. I think it's very crucial part to measure the success and ROI for growth, because otherwise all the new strategies and initiatives won't be working. So first of all, to measure this, first few steps which we need to follow. First is setting the clear goals and objectives. First and foremost, we should set the clear goals and objectives so that what metrics we are choosing, the key metrics for the measuring the growth, should be telling the true picture of the growth in the sense. So, and yes, the second is defining the clear key performance indicators. So, defining the KPIs and the key metrics, we should always keep in mind that they should be quantifiable and they are relevant to the initiatives that we are taking, and should always be trackable over time. So that is something which we always keep in mind. Then third step, we should always have the baseline measurement for any KPIs which we have chosen for the key initiatives. We should always have the baseline number so that we can track where are we at present and what is the future ahead and where are we going with that. So that is very important. The next important part is measuring the data, like where are the KPIs going over time, so that we can have the informed decisions, where the change is required in between the process, so that we can have a decision at a time where we can change our process so that we are going towards our success and growth. And last and foremost, very important is to drive this data and use it for decision-making process.
Very true.
Because this is very much required for that. Another question which you were mentioning is regarding the key metrics, what we should use. So basically, we should group them into various parameters. Like first and foremost, always comes the finance. The financial metrics is very, very important, because if financial growth is not there in an initiative, that initiative is generally going to the dustbin. So various metrics in finance which we can measure is the revenue growth, the profit margins, the cost savings, and the return on investment on the particular product. So these are the financial metrics which we can have. Another group of metrics which you can have is the market share. So market share tells us about the health of the organization in the market. Various metrics which we can use in the market share may be the OPD volumes, the admissions, and our market share to a particular service line or in a geographical area is also important for measuring the health. Another very important is the patient satisfaction scores, because that will tell us how we are delivering the quality and the service standards of the organization. Patient satisfaction scores can be through patient satisfaction surveys, and another is through the net promoter score of the hospital, and all these matters to measure the patient satisfaction. Another important metrics is regarding the operational efficiencies, which we should always take care. So because that will tell us about our operational processes. So what is our average length of stay, OT utilization, room utilization, then bed turnover, OPD to IPD conversions, lab conversions, and all these, etc., can be used for these particular metrics. Another is very important for our organization, if I talk about hospitals, is the health outcomes measures. So how we measure the population health outcomes. So we should be always following through morbidity rates, mortality rates, and the infection rates, and all these parameters. Another most very important is regarding the employee engagement and the employee surveys, because if employee is motivated, and if they play a very crucial role so that the growth initiatives are towards the right track. So that is very, very important to have the attrition rates and all those things in mind. One more, because of the technological innovations and all, we should always have the return on innovation metrics. So that, because in healthcare or in any industry, the technological innovations is must, and we should always keep on measuring all these return on innovations also. So for these, we can have the adoption rates for the new technology which we have introduced. What is the cost savings? What is the efficiency gains which we have in these particular metrics which need to be followed? Just to summarize, yes, it is very crucial to set the right process and have the right metrics in place to ensure that whatever growth initiatives we take are towards the right track. Thank you.
Right. And these are the, you said lot of metrics coming to the play when we are actually looking for the success of any program, right? So these are the important metrics, and how much you actually think that these are connected to the healthcare innovations and somewhere this. What are the innovations you actually like to introduce in your hospitals so that these metrics would be easier for everyone?
I think Dr. Gupta also mentioned innovation in healthcare is required in each and every step of the, be it starting from, if I talk about patient coming inside the hospital, getting it registration. So registration should have been automated. If I talk about Manipal, we have a appointment booking system through our website where the chatbots do the appointments. You go to the website, open the link, and chatbot will book your appointment along with sharing the payment link and everything. So that is very much required. Then if you go from admissions to seeing the doctors, the queuing and all those things, it can be automated and reduced. Waiting time can be a possibility. So that is what is required. If we move from the doctor's chamber to the diagnostics and all those things, there also we need to have each and every area where the innovations and all will help us a lot. Coming to the treatment part, the robotics and all those things, they are always add to the doctors and help in the better treatments and all those things.
Great, thank you. So our last question, and I would really like to take with Mr. Lalit. So looking ahead, what do you think the health system of the future will look like?
It's a very difficult question to answer.
Yeah, this is the most important question so far.
Yes, it is. I'm no astrologer. I'm a practicing administrator, and based on my experience, because it is very easy to start things and to talk about things practically at ground level. Things are much more challenging and difficult. What I can foresee is that in days to come, we should have the system of a unique patient ID and the patient records in place with the use of digital technology. That is something which will come in next few years. And secondly, I think telemedicine will also have a better footprint, and telemedicine will come with its better avatar, that is having certain diagnostic standalone instruments by which you can get the basic parameters of the patient. And thirdly, I believe that we'll have more doctors, better trained doctors, because a lot of medical colleges now, every district in the country has to have a medical college. So the numbers of doctors will increase. And at the same time, since we also have the All India Institutes of Medical Science in every state of the country, so more research institutes. And I believe that the authorities, the policy makers would be sensitive to the fact of technology and health, which is an area about which we haven't had a manthan earlier, but yes, now it's a buzzword, whereby all the curriculums, whether it's the graduate, postgraduate curriculum, or maybe we'll have some kind of an MBA in health technology or health innovations in future. So this is what I foresee.
Great. One thing?
Yeah, you sure.
I think with the patient perspective, the future healthcare will be single click away. Everything will be accessible at home except for emergency and for major surgeries that will be done in hospitals. Rest, most of the things will be available at their home. I think that is the most important perspective we are looking in next few years.
Well said, sir. Well said. Because actually, I also feel in the same way, right? It's just one click away kind of services, so that every patient has their own data, safe data, and also the analytics of the all health records. So I think data should be in this way, that I know that how my body is actually work, to the medicines, to the diseases, to the anything, so that actually these will create a better understanding of our own body, right? So Dr. Charu.
Yeah, so absolutely rightly said by Lalitji and Dr. DK. I personally believe nobody is an astrologer to foresee. I would like to add what Pankaj said in his different matrices. Why are we forgetting? Why are we only talking about the matrices of efficiency? We are talking about OT rate, bed turnover, ALOS and everything. Why are we not talking about how many, due to the use of technology, how many diseases were we able to prevent? What was the community impact? Why are we thinking of Indian system as a sick care system? Why are we not thinking about Indian system as a healthcare system? It should be something people should talk about: health, wellness, well-being, not about getting sick, ICU stay, antibiotics. I know that might be the profitable area of the hospital, but at the same time, when you look in the future, it's all about a click away. Most of the things will be robotic. Most of the things will be VR introduced. We are doing even now the rehab at home with the help of virtual reality. We are not sending psychologists at home for depression and grief bereavement. We are actually using VR to give them a personalized touch through telemedicine and including games and different therapies, so that they come out of grieving and they come out of someone's loss. Why can't we think about bringing such therapies in the community with the help of technology, rather than just talking about different matrices that helps you increase the ROI? For me, the return on investment to actually build a hospital or a company or a vertical is to bring an impact to the community. How many surgeries were I able to kind of prevent? How many procedures was I able to prevent? How many criticalities was I able to anticipate? How many genetic disorders was I able to kind of diagnose at the right time, despite having less than 300 certified geneticists in the country through an application? These things matter. And we should actually move from sick care to health care, and that's what I foresee in the next decade.
Great. And Arun sir, your opinion on this? How you look like health in the future?
No, industry can support with the innovations, and if we don't have that technology, we can tie up with the developed countries industry. And there are a lot of initiatives, even government is taking, our state government has taken some delegations to the abroad and to the exhibitions and other platforms, where we got an opportunity to meet the big players in this field, and those though they have a very limited market in Europe, whereas they are exploring the bigger market in India. So they need some such kind of technological partner and manufacturing facilities, those who can support to their industry as well. And with that, we can bring down the cost of equipments, and we can make an affordable equipments so that even the small hospitals or small health center can afford that. Right. And that is how that industry can also support the health segment.
Right.
Thank you.
And in this, one more question is actually, and I would like to take from Dr. Pankaj. So, how will the current dynamics of growth and consolidation shape the future?
Actually, to answer this, first of all, yes, future is unpredictable, and I'm not astrologer.
But even though we have,
what I want to mention one YouTube TED talk regarding the future of healthcare, where they are mentioning about the virtual hospitals, as Charu has also mentioned regarding the virtual reality, and it's not at all actually under assumptions. We had the virtual hospitals. The hospitals are buying space in the virtual reality space, and Myom Hospitals is also investing on the virtual hospital front. So the future can be immense, and yes, it's unpredictable. Still, it is not at all in the assumption stage, and the future is like that, just as Dr. Gupta has mentioned. It's a one click away for the patient. Apart from the critical care, all the things can be taken care at home. So that's what we are looking at the future.
Great. So thank you everyone for being here and giving your knowledge. And thank you, audience, for this beautiful discussion.